We advise you to watch this video a few times before performing it yourself. You may find it helpful to pause it at various points. Ensure the person is sat comfortably, preferably leaning against a chair to ensure the chest is easily accessible. Expose the patient's chest to observe the port needle insertion site and the surrounding skin for any redness, swelling or oozing of fluid. If any of these symptoms are present, do not proceed any further. Call the Acute Haematology Oncology Unit helpline for advice. Clean the surface you'll be working on. A non-cluttered, clean table or work surface is ideal. Place all the equipment on the cleaned surface. Remove the fulfuser from the bag and inspect it. If the balloon appears full, at number 5, do not proceed any further and please call the Acute Haematology and Oncology Unit helpline for advice. If the balloon is empty or showing at number 2 or less, continue. Place the fulfuser in the open sharps bin. Wash your hands thoroughly with soap and water and dry with a clean towel. Open up the line disconnection pack, only touching the outside of the pack. Do not touch the inside of the pack as this is the sterile field. Put your hand inside the orange bag and use this to arrange the items. Put the apron, gloves and any items in packets to one side. During this procedure, you will only use one pair of sterile gloves. Place the orange bag within easy reach. Put the apron and the oversleeves on. Put on goggles if not wearing glasses. Put the 0.9% sodium chloride to one side. In turn, open up all the equipment by peeling from the edges of each packet and carefully dropping the contents onto the sterile field. Try not to touch any of the equipment as it's sterile. Place all the packaging in the orange bag. Snap the tops off each 0.9% sodium chloride ampule and keep them to one side. Try not to touch the opened tops. Carefully remove the dressing working from the edges inwards. Make sure any tape on the port needle or line is removed as well. You don't need to wear gloves for this. Discard the dressing into the orange bag. Wash your hands again or use hand gel if you prefer. Open the pack of gloves outwards, not touching the inside. To put on the sterile gloves, pick up the left-handed glove with your right hand by pinching the bottom outside aspect of the glove only and pull it over your left hand as far as possible. Do not touch the outside of the glove. With your left gloved hand, pick up the remaining glove, but this time only touch the folded area of it. Place the glove over the right hand and pull it on. Ensure your gloves are comfortable. You are now sterile. Put the sterile sheet underneath the port line. You can ask your relative to pick up the port line to place the sterile sheet underneath, or you can pick up the port line with gauze and put the sterile sheet underneath. From the sterile field, place the drawing up needle onto the syringe. Remove the cap of the needle and place it in the orange bag. Ask your relative to pick up the 0.9% sodium chloride ampule for you to draw it up. Insert the needle into the ampule, keeping it at the tip. Draw back into the syringe. Expel any air by pushing the plunger up. Take the needle off the syringe and put the needle on the second 10 ml syringe. And repeat this process. Remove the needle from this syringe and put the syringe onto the sterile field. Discard the needle into the sharps bin. Use the green clamp to clamp the fuser line, which is next to the white connection. Hold a piece of gauze in both hands and unscrew the connector at the end of the fuser. Place the port needle back onto the sterile sheet. Still holding the fuser tube with gauze, take the white bung from the sterile field and attach the narrow end of it to the fuser tube using a twisting action. Dispose of the fuser tube in the sharps bin. At this point, the whole fuser should be in the sharps bin alongside the gauze used to hold it. Take an alcohol wipe and clean the end for 30 seconds and allow the end to dry for 30 seconds. Dispose this wipe into the sharps bin. Wait 30 seconds for the hub to dry. Attach the first 10 ml sodium chloride syringe to the port using a push and twist action. Push the plunger using a push-pause technique to flush the port. Repeat this process with the second 10 ml syringe. However, for this, you need to flush in 9 ml and leave 1 ml in the syringe. Keep the pressure on the syringe as you clamp the port line and remove the syringe. Place the syringe into the sharps bin. Loop the line into the space on the needle at the top. Lift the plunger up to 180 degrees. With 2 fingers and your thumb, push down to release the needle, making sure it is at 180 degrees. After removal of the port needle, place it into the sharps bin. Put a spot plaster if required, but site may not need this. This completes the procedure. Discard the remaining content of the sterile field, your gloves and apron into the orange bag. This can then be disposed of into the sharps bin. Put the lid on the sharps bin and push into place. You will hear audible clicks. Slide the white hatch across the seal to shut the sharps bin. This also clicks into place. You should not be able to open up the sharps bin now. Complete the date label on the outside of the bin and please return it to the chemotherapy outpatients department at your next appointment. Clean your work surface and wash your hands.